Hello, in this video, we're going to go over viral respiratory infections. So, viruses that infect the respiratory system. There are obviously tons of viruses that infect the respiratory system. In this video, we're only going to go over a few. Viruses love to infect the respiratory system because many viruses travel through the air, airborne. Whenever you sneeze or cough, you are releasing tons of viruses, and then another person breathes them in, and then of course, the first place you're going to end up is in the respiratory system. So, respiratory system is a great place for viruses to kind of infect. And so the first one is, of course, the common cold. The common cold, by the way, is caused by many, many different types of viruses. So the common cold is just kind of a general term for a disease that you get when you are infected with any of these viruses. So different types of rhinoviruses, coronaviruses, adenoviruses, these all cause what we call the common cold. So, there's not really one type of virus that causes this disease, and that's because this disease is a very general term. But all of these viruses are going to, again, they're going to infect the respiratory system. They're going to get in through your nose or your mouth, and they're typically going to infect the mucosal layer of your respiratory system, and that is going to give you your classic sneezing, runny nose, congestion types of symptoms. So here in this diagram, we have the symptoms that you would typically get from the common cold versus influenza. And influenza, by the way, is the flu. So as you can tell, with the common cold, we have a lower grade fever. And then kind of the main differences is that you don't really have your aches and pains too much, or fatigue, but you're going to have lots of sneezing, lots of nasal congestion. Whereas with influenza, that might not be true. So speaking of influenza, that is the next virus we're going to talk about. So it's caused by the influenzae viruses. There's different types as well, but they're all going to be in this group called the influenza viruses. Again, this is going to be affecting our respiratory system, primarily the upper respiratory tract, but it can travel down to your lower respiratory tract, which is your lungs. But yeah, pretty much the whole respiratory tract can be affected. And again, there are different strains of the flu virus. And the reason why is because these spike proteins, the H spike protein and the N spike protein, they can change yearly or seasonally. And so that's why we have kind of the seasonal flu, as some people would say. Every year we have a different strain, and that is because there's different H and N proteins. And these viruses like to mutate a lot, change their H and N protein. So every year we have a new flu virus. That's kind of why we always have to have a new flu shot because every year it's different. And by the way, that is how we name our flu viruses. So, for example, H1N1 is named for H. It has the one. We just use the number one to designate that its hemagglutinin spike protein was number one, and then the N was number one as well. But there's also H1N2, H2N2, right? So all different variations of the same virus. Of course, again, they all cause the flu, but some years it's worse than others. Just totally depends. All right, then we have SARS and MERS. So these are both types of coronaviruses. So technically speaking, they're both going to be causing the common cold, but SARS and MERS specifically cause a disease or infection that is more severe than just the common cold. And so that's why they're in their own category. So SARS stands for severe acute respiratory syndrome. There were two outbreaks of it, one in 2003, and then the most famous, the 2019 coronavirus, also known as SARS-CoV-2. So SARS-CoV-1 was the 2003 strain, and then SARS-CoV-2 was the one that came out in 2019, also known as COVID-19, COVID, etc. Many different names for it. And then there's MERS. This is the Middle East respiratory syndrome. Again, very closely related. And its outbreak began in 2013 in Saudi Arabia. So yeah, and if you look at its structure, very similar to the flu virus. We've got the different types of spike proteins. There's an M protein there. There's an N protein there as well. So again, these viruses all seem very similar in structure, but of course, they have different characteristics. They cause slightly different diseases or just infections. All right, the last kind of group I want to go over are the measles, rubella, and chickenpox. So measles is the name of the virus is called the measles virus. It's an extremely contagious virus that causes high fever, sore throat, rash, and you'll have these complex spots in the cheek, these white spots when you look inside of the cheek. So yeah, that's the classic measles. Then we have rubella, also known as German measles. So you'll have the same kind of rash, but with rubella, women who are infected with rubella when they're pregnant, the child can come out with birth defects. So that's another kind of issue with rubella. And then there's chickenpox, which is caused by the varicella zoster virus. Of course, this gives you your classic pox rash, with the pustules and all that, and you're going to get fever and chills as well. So notice that these viruses, we've categorized them under the respiratory viruses because you do obtain them through the respiratory system and they do infect the respiratory system. But all of these, one thing they have in common is that they'll also produce some kind of skin condition or something going on with the skin. So that's just another thing about viruses is that, they may start in one system of the body, but then spread to other parts of the body or cause reactions in other parts of the body. All right, so that's all the viruses I was going to cover in this video. Thanks for watching, and I'll see you in the next video.